Hi, my name is Julian Zangrilli. I'm one of the orthopedic surgeons at Seaview Orthopedics, and today we're going to talk about the most frequently asked questions going into knee replacement surgery to help you feel as prepared as possible going into that surgery. So the recovery after knee replacement surgery starts the day of surgery by working with the physical therapy team in the hospital. Whether or not you're going to go home the same day or stay one night in the hospital and then go home the next day, we get you up and moving the same day with the physical therapy team. That's our goal. You'll be ambulating with the use of a rolling walker at the beginning, right after surgery. And after leaving the hospital, I encourage patients to continue the exercises that they learned in the hospital with the physical therapy team until their first follow-up appointment. I allow my patients to shower 3 days after surgery with the bandage that they get after their procedure still on. That bandage can get wet while they shower. I urge them to just gently pat it dry afterward. While showering is okay 3 days after surgery, I still do not allow patients to submerge their wound underwater. So that means while showering is okay, no bathtubs, no hot tubs, no pools until cleared by your surgeon in the office. At about 2 weeks after surgery is when I first see patients in the office. At that point, we take off their surgical bandage, we check their wound, we make sure that everything is healing appropriately, and at that point, if everything is going as expected, we start them in outpatient physical therapy. Outpatient physical therapy is somewhere between 2 to 3 times per week, and it is a critical and crucial part to the recovery process, which I always stress to patients before surgery. Outpatient physical therapy generally starts with gentle range of motion exercises, strengthening the muscles that surround your knee, gradually working on range of motion throughout the coming weeks, and normalizing the way in which you're walking with your new knee. At 2 weeks is generally around the point where people start to wean off of the use of the wheeled walker after surgery and start to transition to using a single point or a 4-point cane to help them walk. By about 3 weeks after surgery, I generally have the expectations for patients to be able to fully extend their knee and to bend their knee to about 90 degrees. Gradually, over the next few weeks with physical therapy, your range of motion will steadily increase with the exercises that they give you at PT and then continue on a daily basis at home. At about 3 weeks after surgery, depending on the patient's progress, they may begin to drive as long as they are no longer taking narcotic pain medicine and they feel comfortable doing so. Once we hit week 6 is when I usually see patients in the office for their second post-operative appointment. Every patient is different as far as the activities or the hobbies that they like to engage in. I generally like to sit down with people and really like to discuss the activities that they would like to start trying after surgery that they enjoy in their lifestyle. At the 12-week visit, I generally expect patients and I tell them that they will be somewhere between 90 and 95% recovered. I see them again at 6 months and then again for follow-up at 1 year. Please keep in mind that the timeline for recovery is an average. Some patients are a little bit ahead, some patients are a little bit behind, but generally these are the goals that we want to achieve over time. Slow and steady gains are the important part of the process, and just keep in mind that every knee replacement is a unique experience, and the same goes for the recovery for each patient. Pain control after surgery is targeted in several different ways. First is ice and elevation. Swelling is absolutely expected after surgery, not only around the knee, but throughout your entire leg. So icing your knee 20 minutes on and 20 minutes off throughout the day and elevation above the level of your heart for 20 to 30 minutes at a time are really key during the recovery process. Along with icing and elevating, I remind patients to try to be mindful of gradually increasing activity levels. Throughout the recovery process, we outline step count goals to not only keep patients active and motivated, but also to guide them in gradually increasing their activity over time. There are different medications that we use to control your pain after surgery. Both non-narcotic and narcotic medication options exist. So some of these medications are scheduled and some of them are used on an as-needed basis depending on your pain levels and your medical history. I usually expect patients to be able to slowly wean off and ultimately stop using their narcotic pain medications between weeks 4 and 6 after surgery, sooner if able, depending on their pain. So anytime a patient has a knee replacement surgery, there's a risk of developing a blood clot. Because of that, patients are started on a type of blood thinner after surgery for a period of about 35 days. The specific type of blood thinner that we use is dependent on their medical history, and the combination of using the blood thinner, compressive stockings that you'll receive the day of surgery, and getting up and ambulating throughout your day can help collectively lower the risk of you developing a blood clot after your procedure. Other things to look out for after your surgery are any signs of infection or wound healing issues. Please keep in mind that pain, swelling, bruising, redness are all expected to some extent after your procedure. More often than not, this is a part of the normal healing process. Even after your pain is minimal to non-existent weeks or months after your surgery, it's still possible that you will experience some swelling in the months following from time to time. This swelling should respond positively to a period of rest, ice, and elevation of the leg. If at any time you start to have wound healing issues, draining from the surgical incision, or any concerns that aren't addressed in this video or your discharge instructions, please feel comfortable contacting your surgeon as soon as possible. So overall, we understand that surgery can be a stressful process not only for patients, but also for families, and it's an experience that comes with a lot of unknowns. So please just know that myself and my team are here for you during this process, and we're happy to take care of you the best way that we can.